Hello, my name is John Weinman. I'm head of health psychology at Atlantis Healthcare and head of the health psychology group at King's College London. What I'd like to do today is really just give you a very brief overview of some work we did with patients with end-stage renal failure in an attempt to improve their use of phosphate-binding medication. So really the background to all this, I think, as you appreciate, is that use of phosphate-binding medication is low in patients with end-stage renal failure. And the immediate background to the work that we did consisted of two things. Firstly, we conducted a systematic review which showed just how poor how the rates of use of phosphate binders are in this group, but also showed us that of all the factors that seem to influence patient use, patient beliefs seem to be the real key ones. So we knew we had to focus in that area. We then went on to do a piece of qualitative work. And in the qualitative work, we interviewed 20 patients with end-stage renal failure, and 10 of whom were pretty good users of phosphate binders and 10 of whom clearly had problems. And the interviewer was blind to that. And what that study showed very clearly was that the people who had problems in using phosphate binders seemed to have a very, very poor understanding of a number of very basic things. Firstly, they didn't really understand why they needed phosphate binders. They didn't know about the problems of phosphate buildup in the body in renal failure. Secondly, they didn't really seem to understand the importance of the treatment in preventing massive future problems downstream, and so on. So they appear to be very hazy, very confused, and hence had a very, very low perceived need for using phosphate binders. So with all that in mind, what we did, we set up a study to try and increase patient understanding and increase their perceived need for taking treatment and their understanding of the rationale for taking treatment. So it was a fairly modest study. It set out really to change patient understanding and change patient beliefs about the use of phosphate-binding medication. The study consisted, or the intervention we developed, consisted of two very different components. The first component was actually a demonstration for patients of how phosphate binders worked. And for this we used a glass stomach that was actually loaned to us by the drug rep in the renal department. And in that we actually gave a live demonstration showing how if you put binders into the sort of typical solutions that would be in a stomach, you would be able to see through the glass stomach the contents of the stomach binding and forming a solid mass, which could then be excreted from the stomach by the route that wasn't allowed, as it were, during when one has renal failure. So that actually was a very, very tangible demonstration of the notion of a binder and how a binder worked in the stomach and the importance of taking the binder to excrete the excessive phosphate out of the body. The other thing we did was to prepare a very patient-friendly leaflet explaining the need for phosphate binders, what the problem of phosphate buildup is in the body, why binders are needed, and the importance of taking them in a very prescribed way close to meal times. So that was the intervention. What we did to evaluate that intervention was a randomized controlled trial. Very small numbers, 20 in each group. So patients either had usual care or they went through the intervention, which was a one-session intervention with the leaflet and the demonstration. Patients are then followed up immediately after the intervention, 1 month later and 4 months later. And the idea is to see, does this intervention change patient understanding? Because remember, previously we'd shown that patients had very, very hazy ideas about phosphate binders and how and why they were needed, and certainly how they worked. So the good news is that in both the 1 month and the 4 month follow-up, we found a very, very clear improvement in the intervention group. The intervention group now had a much better understanding. They had better knowledge of phosphate binders, what they are. They had a much better understanding of how phosphate binders work, and also of the need to take phosphate binders in order to prevent longer-term problems in outcome for this patient group. So the intervention at that level was incredibly successful. Small numbers, but it was a randomized controlled trial, but it had a decent follow-up with good measures. There are limits, so we now need to develop this intervention to put it into a clinical setting. Bits of it are being used in clinical setting. The improved leaflet has been partly adopted, and the idea of using the glass stomach certainly has shown a lot of interest amongst clinicians in terms of, and certainly in clinical pharmacists, in terms of providing a rationale for phosphate binders. So I think it's a very interesting area, and it's an area where there's huge scope for improving patient understanding and being able to do something about the very low levels of adherence to phosphate binding medication. Thank you.